Hello, check 1, 2, 3.
Hello.
Hello, check.
Yes, we can hear you.
ताहिर साहब प्रेजेंटर्स नहीं हैं, प्रेजेंटर एक ही है, एक ऑनलाइन है। अच्छा, एक तो जीसी कॉलेज की हैं, प्रोफेसर हैं, कोई लेक्चरर मलिहा, बट लेक्चरर जीसी कॉलेज। Assalamu alaikum. Guests, please be seated. I start with the name of Allah, the most beneficent and merciful. Today I have the honor to moderate this session, which is on factors affecting reproductive health and service utilization. I am Director Research and Survey in National Institute of Population Studies, and I have been working in population and development since 1988. And as Dr. Tausif has already mentioned, it is the only institute in government organization which is doing research on population and development. Two of the participants are still awaited. So I invite Ms. Nausheen Mahmood as a chair. Please. She is a senior demographer as well as currently she started her career from PAP, and currently she is working in a center of philanthropy, and she also has a migration expert group, and she has worked in different fields since long 2-3 years before me, and she has also worked in different sessions. Now I invite our co-chair. She is professor in geography in GC University. FCCU, sorry. FCCU. Before we start the session, reproductive health is very neglected issue, and the factors which are affecting reproductive health, they are being discussed and researched since long. So before starting the session, our chair wants to start the session in a reverse way. She wants to say some of the comments and set the stage before we start the presentations. So I invite Ms. Nausheen to come on stage. Yeah, mic de do.
Bismillahirrahmanirrahim. Assalamu alaikum to everyone, to all the participants and the young students of this university. Why I have taken the decision to say something, I'll not take long, just 4 to 5 minutes to say, because I have to travel back to Islamabad and leave around 4. So the session, can be wrapped up by the co-chair. That is why I thought that I'll just talk a few things or say a few things about the title or the topic of this session, which is very important and quite closely linked with the program or the population program that we are running in our country. And you have heard a lot of comments and suggestions and also views about how Pakistan has been managing and handling the population program in Pakistan. Reproductive health and family planning is an important component, but it is something beyond that also. While we were studying at the universities, I was doing my doctorate at the University of Michigan. We talked about demography and as a discipline in which we study about the population dynamics. What is fertility, how it grows, how it is linked with death rates or mortality, and what is the role of migration, which the interlinkages and the interrelationship. And family planning and reproductive health is a component of that, which is also a means to achieve the end that we are aiming for. That is to have your population in balance or in to be compatible with what your growth is or how your country is developing. So this is just like the basic, and I would like to understand, make all the students understand that population is not only family planning, it is beyond that. And we must understand those linkages and those relationships. I think this particular topic, that is factors affecting reproductive health and service utilization, I think a lot of research has been done in this area. And we also did quite a few chapters, especially when the NIPS started producing the Pakistan Demographic and Health Survey, in which particular information and data was collected on reproductive health indicators. And we came up with certain findings, but it is interesting to see that it would be interesting to see that how the newer generation has looked at this phenomena using different data sets or different methodologies and what they have come up with. Unfortunately, I was not provided with the complete papers that would have made it possible for me to go through, and I would have said something about that. But just looking at the topics, and I think I'm just assuming and thinking that all the topics, they seem quite interesting, using different data sets, and also about the impact of household size on the health utilization services, and also about the impact of climate factors and food security on demographic fertility in Punjab. So these kind of topics, when you have certain specific questions to address, then you take these. But in general, I would say that the factors that affect reproductive health and service utilization are basically the background characteristics of the respondent, the data that you use. And also, these are the traditional kind of factors like education, like urban rural residence, like your age and everything. But also social and economic factors, they come into play, which is what is the more novel indicators, what is the gender situation, what is the women empowerment and decision making, which makes a woman to decide when to use those services and how to use them and access them. I think the most important factor that affects use of these services is the supply system. How your family planning program is working. Are the services available? What quality of services are there accessible? And that is really a very, very important topic and area to study. A lot of work has already been done on that. And we say that Pakistan, for having a successful reproductive health policy and family planning program success, we need not only to generate demand or to access those services, but also a strong supply system. So both should go hand in hand, because when you demand something, the services should be there to be utilized. So these are just my general comments, but it is also good to see that the paper presenters, they belong to different institutions, and which are important ones. Government College University, University of the Punjab, and also I think Pakistan Institute of Living and Learning. I would like to learn more about this organization. I don't know much. But if the paper presenter is here, then maybe we can know more about this. So I think with these introductory remarks, and I may have to really slip out or head out around 4 o'clock because I have to travel back. But now I would just pass it on to Aisha, who can call on the presenters to present their work, and I can sit here for an hour or so. Thank you.
Thank you, Dr. Nashin. Now I would like to invite Ms. Olan Naz. She is a research analyst in the Institution of Research and Development Solution, that is RADS in Islamabad. They are working in different aspects, especially on women empowerment and health and other social issues. So I would like to invite Ms. Olan.
ये स्लाइड्स इधर नहीं आ सकती आपके सामने ठीक है ये स्लाइड्स इधर भी नहीं आ सकती मैं अगर एक्सप्लेन करना चाहूँ यहाँ पे
ना वहाँ पे होंगी वो सामने आ रही
इधर नहीं ला सकते
नहीं मैम बेसिकली
ठीक है ये नहीं चल रहा ठीक है okay sorry Assalamu alaikum everyone. My name is Ola Naz and I'm a research analyst at RADS. So I'll be presenting on unlocking the insights from complex data, leveraging heat maps for decision making in low and middle income countries. So in low and middle income countries, the data comes from multiple sources, such as programs or surveys, which inform about the status of the health and the progress of the health programs. So for effective use of such data, timely and consistent interpretation by the decision makers is needed. For example, in Pakistan, the data of population and the program data, they change rapidly. So for the interpretations, to keep pace with such data, it is essential that we triangulate the triangulation of different sources of data, the analysis, and visualizing those results for quick and easy access is a must. So that the decision makers who may not be data scientists could also understand easily. So innovative visualization methods that offer frequent updates enable near real-time interpretations. So for that purpose, spatial heat maps can be used, which shows the regional variations and hotspots to enhance the flexibility and readability. Traditionally, these heat maps convey simplified indicators such as stock levels, consumptions, or facility counts, but can also depict the intersection of multi-indicators. Bivariate heat maps also indicate they offer valuable insights into supply and demand patterns within a single visual format. So this is important for identifying regions that require immediate attention due to underperformance. So our objective here is to understand the supply and demand patterns for each district through special heat maps and to condense the large volume of data into single visual for decision makers through visualization tools. So moving on to the methodology, the data that we have used is from a contraceptive logistic management information system, which is administered by Chemonics. So the data comes in monthly basis, and we have aggregated it to provide the annual estimate for the year 2022. We have used 5 contraceptive commodities, namely condoms, injections, IUDs, pills, and ECPs. But I'll be explaining only the results for the top 3 commodities. So the National Contraceptive Logistic Information System tracks contraceptive supply from the national warehouses to the provincial warehouses and to the district warehouses and to the individual facilities to track the status of the facility level supply. So we have merged certain districts in based on the population census data, as some districts have been merged or divided since last census 2017. So starting off with the results for the condoms, this is a bivariate heat map, which is showing the association between stock consumed and the stock availability and consumption of this commodity. So on the y-axis, the lighter shade shows the stock availability, high stock availability, but low consumption. And on the x-axis, the lighter shade shows the high consumption, but with low stock availability. So the lightest shade on the top right corner is where the both stock and consumption are performing better. And on the bottom left, both stock and consumption are alarmingly low. In some regions of Balochistan, as we can see, Job and some parts of Sindh, like Jamshoro and Dadu, the stock levels are low, but the consumption rates are remarkably high. And if we look at the Punjab, the South Punjab, the stock and consumption level both are moderately low. I really want to explain the graph. Can I go there? These areas show the stock and consumption are moderate. These areas showing where the stock levels are high. This color on the graph, and this color shows and consumption both are. Thank you. So moving on to the graph for injections. Sorry. It's not changing. यहाँ पे चल रहे हैं. So looking at the injections, we can see their high stock availability and consumption in North and Central Punjab and in Karachi. So if we look at Balochistan, various districts, both stock availability and consumption levels are low. While in southwest of Balochistan, such as Gwadar, Avran and Lasbela, the stock availability is low, but the consumption levels are high. So in Sakhar and Rawalpindi, both stock availability and consumption are performing better. Moving on to the IUDs, compared to the short-term methods, we can see that the consumption pattern for IUDs are low. Both stock availability in Balochistan, both stock availability and consumption patterns are alarmingly low. And in some parts of North Punjab and Central Punjab, stock availability is better. So if you see, high consumption patterns were observed in districts of Nowshera Firoz and Khyber Pakhtunkhwa. As we saw that consumption patterns for short-term contraceptive methods are relatively better from long-term methods. And the overall commodity availability was higher in urban areas compared to the rural areas, especially in north-central regions. So these visualization tools, if integrated directly into the database, such as application programming interface, enables decision makers to perform one-click analysis at their own convenience. This process can also be replicated for the country as a whole for specific provinces or even individual healthcare facilities. And this can be extended even to the medicine supplies or vaccines commodities. And in the era of extensive data sets, employing such efficient analysis techniques, they can connect decision makers with the valuable insights for enhancing the healthcare outcomes. That's it. Thank you.
Thank you very much for a very insightful presentation. Now I invite next participant. He is online. Mr. Mohsin, he is research fellow and economist from Pakistan Institute of Living and Learning in Karachi.
Thank you very much. Assalamu alaikum.
Walaikum Assalam.
Thank you. Are you playing my video or shall I start? I mean,
Start, please.
okay, thank you very much. My name is Mohsin Alvi. I'm from Pakistan Institute of Living and Learning, and I'm in the attachment of the University of Manchester. Someone asked that about the Pakistan Institute of Living and Learning. So this is a mental health organization. It's mainly focused on the mental health of the Pakistani community, and it has a different projects including maternal depression, self-harm and suicides. We have done the mental health psychiatric survey recently in the 53 districts of Pakistan. So this is all about. Unfortunately, I'm in the lobby, so hopefully a bit noise will come from my side, and I apologize for that. So this is the presentation today I have is the impact of household size on out-of-pocket expenditure for health in Pakistan. So we are going to see that does household size really affect on the uh, out-of-pocket expenditure in the Pakistan household. So and how does it impact, with what magnitude does it impact? So, myself is Mohsin Alvi, Muhammad Fasiullah Khan and Dr. Amanullah Khan both are accompanying me throughout this study. So, this is it. Thank you. Can you please move to the next slide? Okay. So Pakistan is facing so many challenges in different aspects, but I think one of the prominent aspect is the socio-economic issues Pakistan is facing nowadays due to some uh, the devaluation of currency and financial strains in the households and other societal issues as well. So that needs to be cope up, and Pakistan is struggling hard to making a strategy and making a plan to cope up these things. This is the setting, Pakistan, where out of around 22% people lives below the poverty line. And out of that, near about 65% people pay out of pocket. Why? Because the our primary care sector is not fully utilized. That's why there's a burden on the secondary section and tertiary care section. And if you go to the tertiary care hospital, so you can see that the a patient is admitted in the hospital in ICU and any other ward, and his family is living outside the ward in the unit and the hospital premises, because the patient migrates from one place to other place in order to seek help and in order to seek the treatment. And once patient migrate, it does not migrate alone, the whole family migrate along with the patient. So this is one of the problem, and the due to issues of this overburden, the people do not get a quality of treatment. That's why people go for out of pocket in order to get the quality of treatment. The impact of household size on the healthcare expenditure. So actually, this is the one of our objective, that we are going to see the how does the household size impact on the healthcare cost and with what magnitude. And in these issues, that the family planning plays a crucial role in order to control the household size, and not just the family planning, but also awareness program that needs to be implemented by the government. Next slide, please. So we are not just highlight the importance of household, but we also look at the relationship of household and the healthcare cost. So this is about the uh, whole phenomena that we are going to cover in this study, we are not just look at the cost for the rural area, but urban setting as well, in order to go for the comparative analysis for those settings. So this is our main objective. Can you please move to the next slide? Okay. So the methods that we are going to apply, it's a desk-based health economics extrapolation modeling that we applied, and we get using the published sources as a in order to collect the data for the 2016, and then by using the GDP deflator, we extrapolated cost from 2016 to 2019, and then we projected that cost from 2019 to 2022. So, and we gathered the data of the household size definitely, and along with the income data, and these are the economic indicator that we got it obtained the data from the World Health Organization and the economic indicators. So we computed the average value of this because the disparities have been found in multiple sources. So in order to mitigate these issues, we computed the average value of this. And then by dividing the healthcare expenditure by the income, we got the ratio of health to income ratio of the household size. This is how we have done. Next slide, please. So this is our results, and results reveal that the household size in urban is slightly higher than the rural. That is accounts for 7.2 in the urban settings and 6.5 in the rural setting. So this is all about household size. And as far as the healthcare expenditure per capita is concerned, so that accounts for 37 United States dollar annually. When it cut down to the monthly basis, so it accounts for 3.1 United States dollar. And when we converted from United States dollar to Pakistani rupees, so it accounts for 857 rupees in Pakistani rupees. So this is the healthcare expenditure for one person in a household in 1 month. So once we multiply this cost with the total number of household as the mentioned in the household size, so we got the figure of total healthcare expenditure of entire household. That is account for 6,172, and the ruler is slightly lower than that due to it has the household size a slightly lower than the urban settings. Why? Because trend is changing. People migrate from rural area to urban area in order to get better opportunity of work, in order to get a better standard of living and the better jobs and so on. So these, on the other hand, this is how we have computed the total healthcare expenditure for the household. On the other hand, we had the average monthly income of the household in Pakistan, that is about 35,000 in 2016, and we extrapolated to 2019, that is 41,000, and then we further projected this to 2022, that is accounts for 47,000 Pakistani rupees. So dividing healthcare expenditure by the total income, so we got to know that 19.5% it's a ratio of health care expenditure to the income ratio in urban setting, and rural setting is slightly lower than this. We are not saying that this could be the only factor for increasing the health care expanding to the income ratio. There will be so many other variables, including exogenous variables and all kinds of variables, but this could be one of the factors. If you have the higher household size, you likely to be have the higher healthcare expenditure. Next slide, please. So this is my last slide, and it's based on the conclusion and policy implication. How we are going to advocate to government of Pakistan that there's a strong need to implement cost-effective interventions, low cost and cost-effective intervention, so that's the treatment and the all thing is will be available to all. And not for this, people should know that and encourage the family planning, and just to reduce stigma, and people need to it needs to spread the awareness that people that these are the planning family planning and there will be benefits of this. So, and we need to emphasize on the family planning and different awareness program. And one more thing, I mean, we should have a strong measure that will measure the economic development of that area. So in not just for the rural area, for urban area as well. So we can see that these are the economic development is happening in that specific area. And this is how we are going to project for after 5 years and 10 years, where we are reaching if we go with this pace. So we need to have a strong measure for that, that Pakistan is lacking at the moment. And the last thing, that addressing the proportion of the healthcare spending in household. I mean, that needs to be also addressed, that this is the proportion of healthcare spending in the household. So public sector hospital should public sector hospital should facilitate the all the patients, so people will not go for out of pocket, and that amount will save to that people in order to build the human capital of a country. Thank you very much.
Thank you very much, Mr. Mohsin, for making us wise on the issue. As we have been informed that other participants are not joined for the training, for the presentations. So if there are any questions for the studies. Any question? Okay, if there is no question, I would like to inform you that we have special chapter in Pakistan Demographic and Health Survey on maternal health practices and other health issues as well. And all students are informed that if they want to do in-depth analysis with NIPS as well or on their own, they have a vast size of data available online, and any student can join NIPS as well. We are conducting several surveys for our research studies, and we advertise it on our website as well as in the newspaper and PEPRA website. So if we are short of lot of students or people, so I can invite them and work with them. We want researchers as well, and we are doing field work for 2 or 3 surveys, which includes extent and patterns of drug use in Pakistan. Another survey is on global adult tobacco survey, and third survey is panel study on unmet need and family planning. And we are conducting these studies in all provinces of Pakistan, and we are short of students as well as researchers. Now I invite Miss. Dr. Khatija, for her insight on all the papers and wrap up the session, please.
Thank you so much, Aisha. Assalamu alaikum and good afternoon, everyone. In this technical session, day 1, factors affecting reproductive health and the service utilization, four presenters was here on board, but at the moment we have 2 presentations. One from first presentation was Miss Alan Nas, and she presented on unlocking insights from complex data, leveraging heat maps for decision making in LMIC, lower and middle income countries. In her presentation, she basically used very comprehensive contraceptive logistic data in Pakistan, and the special focus on special heat maps, and she used the JS application to highlight the different contraceptive commodities, and she basically used 4 contraceptive commodities across the Pakistan, and by using JS maps, she highlighted the different portions of the different contraceptive commodities, its supply and chain, and he highlighted the she highlighted the use of these commodities across Pakistan. So I would like to comment that there is a dire need to make decisions and informed approaches in this regard, and because this is very, very important because we are having very high TFR. When we are having the high TFR in Pakistan, so definitely we are facing and we will face in the future about the demographic dividend. Now the people are and the world's countries are moving towards the third demographic dividend, but we are still there. We are still in the third stage of demographic transition. So it's a very alarming. So it should to create awareness at local level, at regional level, through mass media, through social media, how to use these contraceptives, how they are available, and their demand and supply, because maps are very comprehensive to highlight the areas where there is a dire need to take the initiatives and steps. So this is a very good paper in a way to highlight where we need to focus on to minimize the TFR or the total fertility rate and other related indicators. The second presenter was Mr. Mohsen Hassan Alvi, and he presented the impact of household size on the out-of-pocket expenditures for health in Pakistan, a comparative analysis of urban and rural areas. He again selected the study area is Pakistan, and he highlighted the importance of household size of the healthcare spending in rural and urban areas. For that purpose, he in this comparative study, or for that purpose, he selected 2 years. One was the 2016 and 2020 and 2019 data set, and then he projected the 2022. So in 2016, the average household was 7.2 in the urban areas, but in the rural areas, it was 6.5. So he also projected the monthly expenditures, what was in 2016 and 2019, and what should be in the 2020-22. And again, there is need to take the proper decisions and awareness about the healthcare, their availability of the healthcare at the doorsteps, and we should need cost-effective healthcare and family planning intervention, especially in the rural areas, because although the urban areas are not well equipped about the facilities, the awareness, and many other things, but there is more need in the rural areas as compared to the urban areas. So I would like to wrap up the session because we have only 2 presenters. And thank you so much for your patience and your time.
Thank you very much. As the session is closed earlier, so we can join on the other session in the concurrent session in, I think, hall 1. जी निप्स वाला तो कल है, ये बाकी हो रहा है. It is family planning. E038 hall, another hall. If you want to join that, after that we have to come here for the closing session. Thank you.